Welcome to Lecto. Today we are going to discuss thrombotic thrombocytopenic purpura. As name indicate, thrombotic means several thrombi are formed in the body. Thrombocytopenic means in this disease thrombocytopenia will occur, and purpura means several internal bleeding will occur. Let's start. TTP, thrombotic thrombocytopenic purpura, has two categories. It can be acquired, it can be familial, means genetic. In genetic, mutation ADAMTS 13 mutation occurs, and it causes reduce or absence of the ADAMTS 13 protease. This is enzyme. Actually, if the mutation occur in the DNA, then it will affect the proteins, because from the DNA messenger RNA is formed, and from the messenger RNA protein, or you can say enzymes, are produced. So if the mutation occur in the DNA, then it will affect the enzyme or the protein. So same is in the familial. In acquired, it can be due to the presence of the IgG antibodies. This affect the ADAMTS 13 protease enzyme. It mostly happens in different situations. TTP occur in HIV infection, in use of several drugs, and in pregnancy. So these are the situation after which you can see the TTP, thrombotic thrombocytopenic purpura. Now we will see its mechanism. What will happen? Actually, this is the plasma. We will discuss it three cases: normal case, acquired case, and familial case. This is the endothelium, and this is the plasma. Here you can see in the endothelium there is a granule or bodies which is called Weber palette bodies present in the endothelial cell. And in the Weber palette body, von Willebrand factor present in it, von Willebrand factor, and it release into the plasma. Here you can see. Actually, von Willebrand factor activate only in multivariate form. Here actually this is the multivariate form. In the multivariate form, it attracts several platelets and form aggregation. Along with platelets form aggregation along with the help of the von Willebrand factor. Only when the von Willebrand factor are in multimeric form, and when it is not in use, an enzyme which is called ADAMTS 13 protease break this von Willebrand factor into monomeric form. Here this is the different monomeric form, and actually the von Willebrand factor is actually in protein in nature, and ADAMTS 13 protease enzyme break the von Willebrand factor at position tyrosine and methionine. Actually, proteins formed by the amino acid, and several amino acid combine and form the protein. It breaks the ADAMTS 13 protease break the von Willebrand factor multiple between the tyrosine and methionine amino acid. So in monomeric form, it not aggregate the platelets. But in acquired situation. Actually, when it is released from the endothelial cell, this is the multimeric form. An enzyme, an antibody form in the body which is in IgG nature. And these antibodies, here you can see that this is the ADAMTS13 enzyme. It break the multimeric form of the von Willebrand factor. But IgG antibodies block this enzyme. Actually, this is shown by the line. This is IgG antibody. These IgG antibodies block this enzyme, and so that the multimeric von Willebrand factor will not convert into monomeric form. So it accumulate several or aggregate several platelets and form thrombus. So this is the acquired form. In genetic or familial case, here you can see that this is the multimeric von Willebrand factor. And in that situation, if mutation occur in the ADAMTS13, then two situations happen. First one is ADAMTS13 protease is absent and its number is reduced. So in that situation, if the protease enzyme is not present, then multimeric von Willebrand factor will not convert into the monomeric form. So it will remain in multimeric form and it aggregate several platelets and form a thrombus in the body. So in normal situation, multimeric form converting to monomeric form. But in acquired and familiar case, in acquired IgG antibodies form, in familiar mutation occur in the ADAMTS13 enzymes. So what we will see in the TTP, thrombocytopenia means reduce in the number of the platelets, because platelets are used in the formation of the thrombi. So in the blood, the number of the platelets will reduce. Microangiopathic hemolytic anemia. Actually, it has two situations. When thrombus form in the blood vessel. Here you can see this is the thrombus form in the blood vessels. And when the red blood cell move in the blood vessel and it interact with the thrombus, and when they interact with the thrombus, the red blood cell break. It means the lysis of the red blood cell will occur. Lysis of the red blood cell occur, and due to the lysis, the anemia will happen in the body. Hemolytic anemia. Lysis of the anemia produced by the lysis of the red blood cell. So this is microangiopathic hemolytic anemia. And when the red blood cell break down, we see fragments of the RBCs in the blood, which is called schistocytes, fragments of the red blood cell. And we also see raise in LDH, lactate dehydrogenase level will be increased. So this is the microangiopathic anemia. Second situation is that when this thrombus move to the small blood vessel, it block this blood vessel, and if an organ present after the blood vessel, then if the blood flow block by the thrombus, then the blood will not move to the organ and it causes ischemia. Blood supply to the organs will reduce and it causes the ischemia. So necrosis of the tissues will occur in the different organs due to the formation of the thrombus. Third is the neurological abnormalities. Due to the formation of the thrombus, the neurological or CNS problems will occur in that situation. Renal failure, LDH increase, different anemia occur, and this all situation will cause the failure of the kidney because kidney filters blood. And if the normal components, several thrombus and red blood cell fragments present in the blood, then it causes failure of the kidney. And last one is the fever. So these are the 5 symptoms of the TTP. These symptoms are most important. Next, we will see the treatment. In the treatment, we exchange the plasma of the patient. Because why we exchange the plasma? Because if IgG antibody is present, then it will remove from the patient blood. And if there is no protease enzyme present, then protease enzyme will come into the patient plasma or patient blood from outside. So this is very much important in the plasma exchange. Here you can see this is the person, and here you can see this is the FFP. FFP, fresh frozen plasma. In fresh frozen plasma, or you can say cryo supernatant, we give this to the patient and remove the patient plasma. It means we exchange the patient plasma with the normal. So it will helpful in the removal of the antibodies and entrance of the protease enzyme. So this is the plasma exchange. In some situation we can infuse the plasma. In infusion of the plasma, we only give the plasma to the patient. So these are the 2 situations. In the treatment, we give the Rituximab, which is actually the anti-CD20, and along with the infusion or exchange of the plasma. And second is the Caplacizumab. It actually anti-von Willebrand factor. If the anti-von Willebrand factor, it means it prevents the aggregation of the platelets with the von Willebrand factor. If they do not aggregate, then there is no thrombus and there is no TTPs. In relapse situation, we give the corticosteroid, Vincristine, intravenous immunoglobulin, and Rituximab. Intravenous immunoglobulin bind these antibodies and prevent the blockage of the ADAMTS13 enzyme, along with the immunosuppressant. What immunosuppressant? Cyclosporin, cyclophosphamide, bortezomib. So these are basically the immunosuppressant. So this is the treatments of the TTPs. If you have any question, then you may ask in the comment section. Thank you.